Hi, Samia. It's so nice to see you.
Hi, Lubna. Wonderful to be with you. Thank you for inviting me.
Thank you. We're very, very happy to have you with us. So I'm going to introduce you really briefly and then dive into the question because I'm really sorry that we're a bit late. We started a bit late with your segment, but I hope you've enjoyed the conversation around AI. We kind of had a head start before we
Yes.
started. So I'm very pleased to have Samia with us. Samia is the lead policy specialist from the World Bank. She currently she is currently leading research on digital capabilities and skills needed as the world's economy is shifting to AI-driven delivery models. She is also a board member with Life Lebanon that has supported us and regularly mentors youth. So I think that's wonderful that you actually take the time to mentor the future generation. So welcome, Samia. I'm very happy to have you with us. Last but not least, you are the last speaker of this conference. It's been an amazing 3 days of discovery and curiosity and inspiration. So thank you for being with us.
Thank you so much, Lubna. I have seen and heard a bit the last segment. Mona was amazing, and all the hearts that everyone received. This is really exceptional. Very happy to be with you.
Thank you. Maybe we can start with AI. Like, what are your thoughts on what you heard?
Well, it's very interesting, and I think the question asked by I think Victor was very good. 20 years ago, AI existed already, and nobody talked about it that much, right? It's all about data. So what has happened in the last 20 years is a huge revolution in technology that has really fast forwarded in 20 years the equivalent of thousands of years of technological transformation that humanity has had. With mobile phones, everybody is connected. Everybody is both emitting data and receiving data. Everyone has a digital ID everywhere, recording your location, recording your sentiment if you're on social media, and recording your purchases, recording your loved ones if you're using online platform to find your soulmate or whatever. So technology has really changed not only society, but the human being, who we are, profoundly who we are, how we spend our time, what gives us stress, what gives us joy. Technology, like was said before, is giving us both joy to be connected. I don't know if you remember, there was, it's a while back, but The Economist around 2010 had a series on the impact of mobile phone on Africa. And it was really on the cover, smiling faces of children, of women, of older, elderly people, happy to finally have a phone and be connected. So the first impact of all that connectivity was finding identity for people who didn't exist there, who are now with a phone, they exist, but also with all that has happened since with online services, mobile apps, building a huge trail of data. Now, the question is that good or bad? And of course, like everything, technology is very neutral. If you have good intention as a company, as a government, as an entrepreneur, if you want to use the data you have to cure certain things, to cure diseases, skin cancer, breast cancer, child leukemia, mental health, of course, technology is going to be good. If you have bad intention, you want to steal people's mobile wallets, you're going to be the worst that technology has brought. And we see already a lot of the impact of cyber criminality on our everyday life. So it's a double-edged sword. And the question before was excellent. What is the role of government? And Mona said it, you said it, Lubna. Governments have to regulate, they have to police in a way for AI for good. And you have several groups, especially in Europe. The European Union has the AI for good think tank. They have AI for ethics. They have a lot of public-private partnership to really advise the EU and European countries on how to talk to private sector innovators, the big ones, the Microsoft, the Google, the Meta, in terms of allowing them to be innovative, but at the same time, putting guardrails to make sure that that data is not used for nefarious uses, that there's certain minimum amount of data privacy, and there is the ability of an individual like myself to get out of it. If at some point I decide, okay, I use this app, it was okay while it lasted, no more, erase all my data. So an opt-out option, which should be part of how an application is built and how a user can get in or get out. So lots of things to explore in that. But I'll go back to you for other questions.
So I hear you say that it's both good and bad. It depends on your intention. And if we were to play a would you rather game and you can only choose one, good or bad, what would you choose?
You know, I'm an optimist, and that's why I'm in that field. I would say it's for good. I really hope that the good prevail. It would be too sad otherwise, wouldn't it? And we are seeing amazing application. I'm right now in Abu Dhabi. I visited an excellent university, Ben Zayed Artificial Intelligence University, where I talked to people, students of all disciplines, not just AI, social studies, health, biology, geography, and really what is the applications that are being thought of are not just like, I'm just coding for coding's sake. No, I want an AI application to help solve climate crisis, to be able to better manage the food supply for food security. I want to be able to predict based on weather forecast of the last 6 months, 10 years, whatever, at this particular location. A, how is the road safety element? B, what type of crops I should plant? And C, what can I do for that land, for that territory to optimize on natural resources, optimize quality of life for humans while minimizing the carbon footprint. So AI can help us do amazing things. And I'm not saying it's 100% good, because we have to temper it with a little bit of our wisdom, having been on Earth and seeing how things unravel. But a lot of my job is advising governments on how to use technology, how to best use mobile, how to best use AI, how to best use digital government, not to surveillance, not to monitor people or businesses, but to help the government deliver better service, because governments have a mandate and a job to deliver better service for people, for businesses. That's how they get taxes. That's why you go in the public service in good countries to serve your people. So a lot can be done with technology while reducing the cost on the taxpayer, reducing the cost on government, and doing bigger and better. And we're seeing that all the time. I'm seeing this in the Gulf. We see a lot of that in Europe, Asian countries, Singapore, South Korea, Japan, amazing stuff. And I think this is very inspiring to make us hopeful for use of technology, especially AI, for the better. The problem with AI is it's all that data that is running free, coming from different sources, whether it's my data where I walked today and I got lunch that was captured by my mobile provider, whether it's what I posted on LinkedIn or X or Meta, and data that comes from my financial transaction. Also for this purpose, data from my medical records, right? I'm seeing my doctors, I have electronic data. I could be somebody who's having mental health. So there is a little bit to pause to see if we are, especially using AI, for example, for health, which is one of the biggest use. And by the way, getting so much investment. Japan is leading on that. So using AI for better health, being able to be proactive, detect in advance potential illnesses, even looking at your genes and kind of being able to help you figure out what path to take because you have that particular gene that might, deter something. I think AI for health has tremendous opportunity. The double-edged sword is, for it to be effective, it's going to have to look at patient data, at patient record. That's one element. So how do we feel about that as society, as individuals, as government, as Ministry of Health? Who's looking at it? Mostly a private sector provider, maybe a big company, or maybe a great entrepreneur like Mona, who has a good idea, who has gone through a personal challenge, or who has had a good idea and creates a company to use, let's say, AI for maternal health, or AI for better taking care of your baby, or whatever. The possibilities are really amazing in this. How to help these entrepreneurs and these businesses that are embarking on that AI innovation train without any bad intention, with good intentions, and of course, wanting to make profit. It's very normal. They're investing and of course, they want to make money. Who doesn't? But making sure that they operate under an environment which is at the same time conducive of innovation, but respectful of data privacy. That is why you need very good data privacy that are at the same time the yin and the yang, balancing how much the private sector or the government can acquire, anonymizing. There is a whole science behind anonymizing record. Okay, you can get my medical record, but nobody will know it's me. You cannot bring it back to me, to my address, to my husband, to my daughter. That's a, and a lot is happening in that space to make the best of both worlds.
I
Over
love
back
that.
to you.
I think so this brings me to a conversation around open AI. There are a lot of people who are pro and a lot of people who are not so pro, right? Because of the data and what is being done with the data. Yes, it's been very good, but there are potential harms. If you could choose, for example, one AI invention in the space of mental health that you feel is a need that could be funded, that you see, what would you choose?
That's such a good question, Lubna. And I was looking at, I'm not a mental health specialist, but I do a lot of, in my own organization, I'm what is called respectful workplace advisor. So I do a lot of listening. People come to me for problem. It's anonymous. I have visitors. And I've been doing it for 6 years. And I think many people said it before me. Dr. Kat said it, and she was amazing. Since COVID, people have more and more mental health issues. I think the number is in the last 10 years, there's a doubling per capita of mental health incident, or maybe it's now recorded, but certainly I can see in my own workplace, and I have been working at the World Bank for 30 years this December, so trust me, I know how my workplace is. There is a huge amount of stress, anxiety, fear of the future. AI, by the way, is part of it. Am I keeping my job? Am I losing it? I'm a translator. Everybody's using now the translation feature. Am I losing my job or am I keeping it? Very existential and very important questions that, unfortunately, in my view, even the workplace leaderships in most of these big companies, they try to avoid it. They try to avoid it because they think people will forget, it will go away. In my view, you have to talk about it. You have to have forums, you have to talk, you have to hear your staff, you have to reassure them if there's nothing to worry about. And one thing that any good company can do, it was mentioned before, is provide not only mental health support, but also opportunities for lifelong training for people who are affected by the advent of AI, the advent of automation, technology, automatic data entry, for example, speech to text. This affects low wage jobs, but it affects a lot of them. And I see that every day. So how do we have as an employer, especially large employer, the honesty and the candor to reflect on staff's mental health issues and find ways within the budget to budget and sustain ways to remediate it, whether it's through counseling, getting mental health coaches, specialized on-site, having a hotline, lifelong learning, possibilities to rotate, etc., etc.
And do you see, for example, that a lot of these organizations are actually dedicating the budget to that, or do you feel that there's still more hesitation in that space?
For large organizations, Lubna, I think the case has been sold. Employers know. And you saw the big wave of retirement, exit, early out during COVID. This really hampered the competitivity of a lot of companies. I think the large companies who can afford it, size 5,000 plus, I'm seeing a big increase in either internal processes to do the triage. People like me who, people come and talk, complain, vent. Sometimes it's bullying at the workplace. Sometimes when you have a fear of something, you know it better. I'm not an expert, but you get angry at your coworkers. We're seeing a lot of this. So how to de-escalate, but also a lot of the issues I see, I refer colleagues to our mental health clinic who themselves outsource it to really qualified, competent people, because we don't know the demand. Is it like 1 a day? Is it 1 a week? Is it 10 a day? It all depends. And sadly, let me just interject this. This is not scientific, but I really think the state of the world, COVID and all what's going on, financial crisis, never-ending wars, refugees, millions of refugees that you see that every day on TV. It's hard to turn it off. And I think nobody can deny that this adds to our existential anxiety of, just being there and living a life where we want to have a lot more happiness than anxiety.
So you would focus a lot on existential crisis or living with purpose, more or less. And how do you interject that? What to you is, if you had a formula, and we've asked this question to all the speakers, if you could identify a formula for purpose, what would that mean for you?
So I am lucky that I like what I do. And I think it's a luxury, because a lot of people, it's just a job. So the formula for purpose comes when you have a quality ecosystem and community, and employers can do a lot. Employers can do a lot. You don't have to be best friends with your next door neighbor. Now we have open space, so everybody hears everybody. You see who comes in, who gets out. There's no privacy, so it adds a little bit. So you want to coexist in peace. And employers can do a lot. They can do sessions on wellness, on well-being. I love the yoga at your desk. What a great idea. I would do a lot of it. And you will see this will increase the well-being and the serenity of people. My daughter goes to work in a media company, and she loves it. But, they've been having a lot of cuts, writers' strike. It's very stressful to go there. And what gives them some serenity is the employer is there. There's some nice music. There's a gym. There are classes. They offer fruits, every day, not junk, but fruits. And there is also the ability to call a counselor in place. And it's not a mental health expert, but that person can refer you. You have the insurance. So really don't let things fester, because that's the worst, when things fester. So for me, the key recipe is have a lot of elements in the workplace for solid team building, dispute resolution, de-escalation, some freebies that the employer can kick in, like I said, fruits, yoga classes, the counselor on site, the mental health clinic where you can go listen to some music for an hour. There are some books you can reconvene, and you can go back more serene and ready for your job. Helping pregnant mothers or moms who had just their babies and who are worried, things like lactation rooms. These things are really very good to improve the well-being at the workplace. This is the top. Like very, very superficial, but going deeper, having specialists that help, having qualified HR is so important. HR that are not just there to help the managers or just recruit, but like I just got in when she was leaving, but I loved her, the chief heart officer. My God, what an amazing concept.
Yeah.
Really, that's amazing. And that type of approach to HR, marrying it with psychological care, mental health, etc. It goes hand in hand. Over back to you.
Amazing. I want to ask you one more question, and I'm being told by my team to transition because we have people asking questions. My last question is about Life. You're a board member at Life, and you invest a lot of time in mentoring the younger generation and the future leaders. I think it's so incredible that you actually take time to do that and to get engaged in Life. Tell me more about that. Like, why do you choose Life specifically, and why the future generation? What does that mean to you?
Absolutely, Lubna, absolutely. I'll go a little bit on a personal story. I emigrated to the US from Lebanon when I was a young woman to study. I left my country in a state of war, extremely sadly, and we don't want to get there because I don't want to cry on video. It is even worse. But I always felt like I wanted to give back. And I'm at a stage now in my life. I've been working for 30 years. I knock on wood, it's not like I'm complacent, but I can give back and I want to help. And we see so many young Lebanese in Lebanon stuck because of all the crises we have, with amazing talent. And we're trying to do a lot of what we call offshoring. With technology, a lot of jobs can be created, God willing, when the war is over, can be created there, and we can keep our youth instead of having them immigrate. And also, as you know, immigration also has a toll on your mental health. When you leave everything behind, you abandon your parents. I suffer till now of it, that feeling that I abandoned my family in a way. I try to compensate in different ways, but it's a scar that never heals. So for me, life was that organization of honest people, very successful, no corruption, willing to give whatever disposable income they want towards education, especially brilliant young kids who couldn't pay anymore the tuition when all of a sudden the Lebanese pound went and lost like 100% of its value, which is like crazy, right? So I've been a big promoter of life. And to my mental health, to respond to you, I think coaching, mentoring, volunteering, you read it in books and there are bookshelves of it. To me, it works. It makes me feel like a good citizen. I'm paying a little bit back. I'm giving back something that I can. It's a question of time and energy, and thank God I have it.
And I love your answer, and you were getting a lot of hearts as you were answering that. Because first of all, we remember stories as humans. We remember stories, and that's one of the reasons why I called the company Stories. And
Brilliant.
I also loved the sentence about, the young leaders in Lebanon who are incredible. As a matter of fact, we have a lot of people on the team who are still based in Lebanon, members of the team and interns on the team. And despite everything that was happening in the last 2 weeks, they kept going and they kept showing up. And I'm so incredibly grateful to them. And it's a nice segue to almost end our conversation today, because honestly, we couldn't have done any of this without them. And without their incredible resilience. So I'm really, really grateful to them. And I love the fact that you're actually using your time and energy to give back, because they deserve it and more. I'm going to transition now to bring Nadine back on screen. Thank you so much, Samia, for all that you've done. Thank you for being part of this. I know it's
Of
very
course.
late in Abu Dhabi, and thank you for being with us.
Thank you.
Can I bring
Fantastic. Thank you so much.
Thank you. Nadine, can you come back on screen? I believe we have one question.
We have a question that says, how do you see AI being used to bridge the mental health support gap in underserved regions? And what challenges or opportunities do you anticipate in implementing such solutions?
Excellent question. A lot can be done with AI. Look at generative AI, ChatGPT. If you had a specialized, let's say, mental health component just to pre-screen the symptoms. How do you feel? How is it today? What is your mood like? What are you taking any medication? Some pre-screening, like a human would do, just to assess your case today. That's great. But then also, like, look at past data of you, if you do that on a regular basis, and start to see pattern, and start in consultation with a real expert, already facilitate for that expert the groundwork, that a lot of data has been done, a lot of data mining, and this patient needs XYZ. And then you can check the data over many similar cases, same population, same age group, same region, same location. Culture elements have to enter in it, circumstances have to enter in it. So I think with a bot that is a smart bot to do the intake, when it gets to the mental health professional, a lot has been done, and the mental health professional can dive right in. So a bit what one lady said, that answers the email that I don't want to answer, or collect the data that takes so much. So that would be a very good use of that particular application. You can add to it if you have access to medical records, past history, family history. You have a family history of depression. You're the first person. No, it's a trend. You see, and this would allow, once it comes to the professional, a lot more richer engagement and a better diagnostic.
Thank you. Thank you so much. I do want to stick to time. I know we're up at time, Nadine. So I'm going to stop here and say a huge thank you to you, Samia, I'm very grateful for your time, for your energy, and for always cooperating with us as we were, putting together this conference. Your energy is incredible and infectious. So thank you so much.